We've been joined this morning by our guest, and I will let Tobasi Tom handle the introduction.
Of course, with us in the studio to talk about issues with family planning is a professor of obstetricians and gynecology, and is currently the Dean Faculty of Clinical Science, University of Rio. He is also a chief consultant, obstetrician and gynecologist in the University of Rio, Teaching Hospital, and a fellow of the West African College of Surgeons and the International College of Surgeons. He is Professor Anyekan Abasiatai. It's so good to have you in our studios today.
Thank you very much for inviting me. Good morning, viewers.
Good morning, sir.
But just before you joined us, we were talking about how important it is for Nigeria or Nigerians to look at the family planning, or maybe make it implement it as a law to ensure that we could maybe cut down on the birth rate in Nigeria, considering our challenges, economic challenges. But in your viewpoint, how important is this?
Well, family planning is the action taken by individuals and couples to space their pregnancies at appropriate timing and ensure the effective numbers of pregnancies. Now, in order to promote the health and well-being of the family group, family planning has enormous advantages. Apart from preventing pregnancy, unsafe abortion, which contributes a significant number of women that die, it also has several non-contraceptive benefits. That's benefits that are health benefits that are not related to prevention of pregnancy, like preventing sexually transmitted infections, including HIVs, and even some female genital tract malignancies. So family planning is a very important aspect of reproductive health and maternal health because of these reasons.
Okay.
Now still talking reproductive health.
Yes.
At what stage is it required for a couple to begin family planning?
Family planning is a fundamental human right. A woman has, as we speak now, currently, we believe a woman has the right to decide when to get pregnant, how many pregnancies she wants, and how frequently she wants to conceive. So it's a couple decision. There is no fixed period or time. It has to do with, that's why it's a family planning. The families sit down and say, look, we want to get pregnant so time. We want to have this number of children and want to have them at this interval. And that's because, like I said before, unwanted pregnancy is significantly associated with the high number of maternal deaths in our environment. I'm sure you know that the number of women that die in this environment is still quite worrisome when compared to what happens in the developed world. And more than almost half of these women die because of complications from unwanted pregnancy, of course, unsafe abortions. And of course, when women get pregnant too frequently, particularly more than 5, it's significantly associated with maternal death. So contraception or family planning methods prevent this from occurring.
Okay. Do you feel, apart from the medical point of it, looking at the society, do you feel birth control can actually boost the economy or help the economic situation of Nigeria to improve?
If you reduce the number of children women have, the woman lives a better life, functions better, and of course that relates to the level of economic development in the system. Right now, we're talking about high fertility rates, and of course the population explosion based on that. So contraception or family planning methods have significant impact when it comes. And remember, like I said, there are also certain family planning methods. For example, there are some methods that prevent cancer of the ovaries, cancer of the lining of the uterus, and this protective method or this protection lasts for several years even after discontinuation of the method. So it's all encompassing, in improving women's health.
Well, we know there are a couple of methods like the barrier method, of course, hormonal method, and all of that. Which one among the different methods, or maybe would you let us in on the different methods that are currently available?
I usually classify them very simply as reversible, and non-reversible methods. Reversible methods means methods when you discontinue, fertility returns. Now, non-reversible methods are supposed to be permanent. When you initiate or use those methods, you probably will never conceive again. So under the reversible methods, you have the hormonal methods like you mentioned, where substances are inside the contraceptive agents act to prevent pregnancy. Then you have the non-hormonal methods, those that don't have hormones in them, like the coil, the copper T, the coil, and then the barrier methods, and of course the fertility-based awareness methods, what referred to as natural family planning methods. So in general, that's how I'll classify them. But having said so, in brief, currently the most effective methods, non-reversible methods, are the long-acting contraceptive methods. That's the implants, where you insert an implant, a rod-like structure beneath the skin, and then of course the coils.
Okay.
Yes.
So,
The intrauterine devices, what I refer to as coils.
okay, now,
That's in general. But sorry, one last thing.
Okay,
when you're initiating a method, the provider with you discusses all the methods, and then with your cooperation seeks the most suitable method for you.
that's where I was going.
Yes, that's usually how it is. And of course, most healthy women can use any method, but there are certain medical women with comorbidities, medical disorders, that may have adverse effects using certain types of contraceptive agents. So the WHO developed a medical eligibility criteria that places you in categories to enable you use the most suitable method for those with medical illnesses.
Okay.
Yes.
But a lot of times, if you get to a primary health centers, it's more of a trial and error.
So I didn't get that.
In most of the primary health centers in Akwa Ibom,
Yeah.
it's more of a trial and error, because I've met a couple of persons who say, okay, I was given this, it had adverse effect on me, so I was advised to take it out and try this other one. If you say there is a way to know which one fits better, why do we still have those cases?
Well, I may not be, since I wasn't there, I don't know what had transpired, but like I said, as we speak, the contraceptive prevalence in the real world is it's the norm, not the exception. When you want to initiate a contraceptive agent, like I said, the contraceptive agent available, family planning agent available, it's placed beside you. Sometimes you even use illustration, and then in discussion with the client, the best method suitable for the client is chosen. Now, virtually all contraceptive methods have their minor side effects. So, like I said, you try to introduce a method or initiate a method for a client that is suitable for the client. I'll give you an example. If a client has hypertension, for example, you won't offer her oral contraceptive pills. And some contraceptive agents have certain side effects that may not be appealing to women, particularly if proper counseling is not given. For example, if you initiate the injectables, the long-term injectables, 3 monthly or 2 monthly, one of the side effects they have, sometimes a woman can have an abnormal bleeding pattern that may be erratic for the first few months until her system stabilizes. Now, when you don't counsel the client well to expect that, and she starts going to the market and sees blood, she may discontinue. In fact, that's the most common reason for discontinuation of the methods. So it has to do with counseling, initiating the appropriate contraceptive agents for that client itself. That's one of the, and of course, you know that there are a lot of misconceptions and misinformation on contraception, even among health providers.
Yeah.
So these are the things that increase discontinuation rates.
I want to find out. There are quite a number of misconceptions as far as family planning is concerned. I know that one of them is the fact that a lot of persons say children are gifts from God. Why do you want to stop the gift of God? So let's look at some of those misconceptions and how to handle those misconceptions. Let's start.
Before I just say something, I'll say because of advances in medicine,
Yeah.
current family planning methods you have are extremely safe and very effective. Extremely safe and very effective. Now, in this environment where contraceptive acceptance and use is very low, I said before that in Nigeria, the demographic and health surveys show that just about 12% of married women are currently using a modern method of contraception. It's because of certain misconceptions, like you say, and beliefs. For example, some people believe that they cause infertility. Some believe husband's refusal, religious reasons, and all that. That's what they usually say. But most of them are unfounded. In fact, virtually all of them are unfounded. Most contraceptive agents, when you discontinue them, fertility returns immediately. And like I said, they're extremely safe method. And then you talked about God said raising children, but your colleague now talked about population explosion and large family size.
Yeah.
And I tell you, as a gynecologist, when a woman gets pregnant and does not want the pregnancy, she can go to any length to procure an abortion. Any length. Particularly in this environment where abortion laws are restrictive, where abortion is only permitted to save the life of a woman. So most abortions, if not virtually all, are done clandestinely in very terrible circumstances. I've personally treated patients who've come with very terrible complications, having procured abortions using things like cassava sticks, bicycle spokes, and all sorts of things. So what the point I'm making is, if you say that when a woman doesn't want pregnancy, the only option she has is to procure an abortion, but contraception prevents that. So it does have a place. And like I said, you can, at a certain stage, you think of the health. We're not talking of women's health. A woman cannot start giving birth to 12 children now. 13 children, like what happens before.
Well, what happens?
Because by the time this, in maternity care, they have associated significantly with maternal death and long-term illness.
Okay.
And of course, infant death.
Yeah.
Yes.
Let me quickly ask this now.
Please do.
Before now, we had women, like you rightly said, give birth to as much as 12 children. Health-wise, what's the recommended age that a woman's body can carry?
Between ages of about 22 to 26. 22, 26 to 28. Yes.
And what's the recommended
2 to
number
4.
of children? 2 to 4.
Yes.
And
Shouldn't be more than 4. Shouldn't be more than 4.
Shouldn't be more than 4.
Yes.
Medically.
Shouldn't be more than 4.
And if it's more than 4, what are the disadvantages? The risk, yeah.
Like I said, they are prone to a lot of issues. They can die. Those are the ones that are prone to having bleeding when they deliver. All sorts of obstetric, all sorts of complications during pregnancy. Yes, all sorts. Premature labor, abnormal lies, low-lying placenta that will lead to hemorrhage. Difficulty because each successive baby tends to get bigger. And apart from that, they have a medical condition we call, I don't want to bother with this, spondylolisthesis, where the baby doesn't fit well into the pelvis, and when they go into labor and labor becomes obstructed or difficult, they are very prone to ruptured uterus. In fact, that's what they contribute significantly, and you can imagine when the uterus ruptures in labor. And of course, when they deliver, postpartum hemorrhage, that's heavy bleeding after delivery, they are one of the risk. They constitute one of the risk factors of that.
Well,
so that's why we advise that you shouldn't deliver too many children.
Interesting. But quite quickly, you mentioned a natural way of family planning.
Yes, currently called fertility-based awareness methods.
Okay, let us in more on that.
It's also a method of family planning, but it's not as effective as the other modern methods. Yeah, it's not as effective. People use them. You have usually they are related to the fertile period of the menstrual cycle. Those methods have a relationship. You calculate the fertile days of the menstrual cycle, and then women avoid sexual intercourse during those periods. Okay. That's the basis of the fertility-based, formerly called natural planning, but fertility-based awareness. You have many of them, fertility-based awareness periods. But like I said, because of their high failure rate, the modern methods usually are more preferred. Okay. You can't compare modern methods of family planning, like the implant, have fantastic effective rates.
Okay. Now,
Yes.
you said earlier, you talked about an age span between 22 to 28. What happens to a lady who gets pregnant at 35?
We are obstetricians. We manage pregnancies accordingly.
Okay. So, but the risk factor for that woman is higher compared to a
High
younger
maternal
woman.
age has its pregnancy risk
Okay.
factors.
Okay, like you mentioned.
Teenage pregnancy has its risk factors.
Okay.
They are all associated with adverse risk factors in pregnancy. High maternal age from age 35, and of course teenage pregnancy. They have their peculiar problems.
So, in talking about family planning, how do you manage cases where you know that this particular client is at risk? Peradventure, she proceeds with this pregnancy, and then her religious belief that might mar her maybe opting for family planning as a means of survival.
I'm trying to get your question. How do
Okay.
you mean?
How you manage a client who has a religious belief that's against family planning, and you know she needs this to stop production of children.
Well, when you say religious belief, I think that belief has to do with
Her church does not support
the only
family planning.
the only sect I know still accept a fertility-based awareness method. So she will use that method.
Well,
Okay.
Do you understand what I'm saying?
not sure.
The only set that I'm not aware of any religious group that of course at the baseline when you counsel a patient to accept a family planning method, you're counseling the patient. She must accept it voluntarily. You're not going to coerce her to accept a family planning method. You will discuss with her. But like I said, I'm aware that there are some religious groups that may not necessarily accept a modern contraceptive method, but some of them do accept one or two of the fertility-based awareness methods. So they can also use that.
Okay, your overall, what would be your last words on this particular subject before we call it a day?
Women should be, I'm a gynecologist. We believe that a woman should control her fertility. She should decide when she wants to get pregnant, how many pregnancies she wants, and at what time she wants to, and if she wants to get pregnant. And women should have access to safe and effective contraceptive methods voluntarily.
Well,
It's their right.